Buenas noches. Good evening, everybody. Thank you so much for taking the time to join us tonight. I'm Dr. Minerva Romero Arenas. I'm an endocrine and general surgeon at New York Presbyterian Brooklyn Methodist Hospital, and I'm an assistant professor of surgery at Weill Cornell Medicine. I'm also one of the founding members of the Latino Surgical Society. And on behalf of the founders and myself, I want to say thank you and give you a warm welcome to thank you for joining us for the program tonight. The Latino Surgical Society was established to cultivate, nurture, and support the advancement of Latino surgeons. We want to thank all of our institutional members who have demonstrated a commitment to not only the Latino Surgical Society, but also to the members at their own institution by joining as institutional members. We have the University of Washington, Seattle, Emory University School of Medicine, University of California, San Francisco, the University of Texas at Austin, Massachusetts General Hospital, Morehouse School of Medicine, the University of Alabama at Birmingham, University of Florida at Jacksonville, Oregon Health and Sciences University, Harbor UCLA Medical Center, Penn State Department of Surgery, Houston Methodist Hospital, and Penn State Health, Hershey Medical Center. We also want to thank you, our members, who have supported LSS, but also who have been able to finally connect with us virtually throughout the pandemic and in person most recently in San Diego. And so with that, I would like to say, let's move forward together and keep building the community that we've tried so hard to keep together during the past few years. I want to thank and turn the programming over to our Inside the Operating Room director. We want to thank Dr. Ana Sofia Ore Carranza and Dr. Rick Baboliza, who are our co-directors this year. And I'm going to turn the programming over to you so that we can go ahead and get started with the official program.
Great, perfect. Thank you, Dr. Romero. And welcome everyone to another session of Inside the Operating Room. Tonight we have the pleasure of welcoming Dr. Antonio Picon for the 13th installment of our series. Dr. Picon graduated from Universidad de los Andes in Venezuela. He completed his general surgery training in Venezuela at University Hospital of Caracas. He's a general surgeon and surgical oncologist. He completed his training in general surgery at Mount Sinai Medical Center in New York, and then completed the International Surgical Oncology Fellowship at Memorial Sloan Kettering Cancer Center, and a traveling fellowship in Japan at the National Cancer Hospital in Tokyo. He is currently the Associate Program Director of the General Surgery Residency Program and the Director of Surgical Oncology at Stamford Health in Connecticut. He was awarded with the Educator of the Year Award in 2014 and Attending of the Year Award in 2016 and 2020. Dr. Picon, welcome to our webinar today. Thank you so much for joining us.
Well, thank you for the invitation. Thank you so much for the invitation, because when I heard about this program, I initially thought, I don't think they're going to invite me. I don't think I belong to that group of people. But I was surprised to receive the invitation a few weeks ago and participate. So I'm very, very happy to collaborate and to participate. Thank you.
Thank you for taking the time. We are looking forward to learning a little bit more about you and hearing about your career. And so why don't we start talking a little bit about your background? Why don't you tell us, where do you come from? And how did you choose a career in medicine?
So I'm from South America, from Venezuela. I was born in Mérida, a small town, it's a university town. And initially, I wanted to be a priest. When I was 15, I was an altar boy, and I used to pray the rosary every day with my grandmother. And at some point, for some reason, something clicked, and I decided to go into medicine. And I remember that I read a magazine in Venezuela in Spanish that they had a huge and very extensive report about heart transplants, and with Christian Barnard doing the first transplant in South Africa. And after I read the article, I thought, this is for me. I think I want to be a heart surgeon. I want to be a surgeon one day in my life. And from that day on, I persisted to be a surgeon. And I was, I think, maybe 11 or 12 years of age. And that was my dream. And at some point, I said, I want to be a pediatric cardiac surgeon. So I went to medical school thinking I was going to be a surgeon. And I never thought about coming to the United States. I didn't speak English very well. I had basic English. I said, I don't think I'm going to have the level of English I need to have to go to the United States and train there. So I said, let me go through medicine. So I went through medicine thinking I was going to be a cardiac surgeon. And I persisted. And I remember that in the middle of my school, the medical school, I said, I'm not sure if I want to be a surgeon. Because I remember that we had a subject in medical school called surgical techniques. And the professor at that time used to give grades for our class, and usually 0 to 20 in Venezuela. And he used to say 20 is for the professor, 19 or 18 is for the book, and students only get 13 out of 20. So I remember that was so strict, our classes, that I said, I got 13. I said, I don't think I can be a surgeon. So I was a little bit disappointed, but I said, I have to persist. So I persisted and I finished medical school. And from that day, I finished medical school. I said, I want to go to the United States. So I went to Caracas from my town, Merida. And in Caracas, I did something called mandatory internship for 2 years in Caracas, doing different rotations in the hospital before we entered residency. And I took my exams to come to the United States. And I said, I want to be a surgeon. And I remember that during a rotation, in one of my surgical rotation, I was scrubbing with one surgeon and we were doing a hernia repair. I was assisting that surgeon. And I made a comment. I said, I want to be a surgeon and I want to go to the United States. And I remember that surgeon stopped the procedure and looked at me and said, I don't think you're going to get a position in the United States. Don't go there. Don't apply. It's going to be impossible for you to be a surgeon in the United States. Don't go. And I looked at him and said, okay, no problem. But I will persist. I will be very persistent to be a surgeon in the United States. And that's when I started the process to get into the exams, the applications, and that's when I came here.
Well, that's an amazing story. And I have to admit, it sounds a little bit familiar because I actually also did medical school in South America, in Peru. And the surgical technique class sounds very familiar, and the grading sounds very familiar too. And I think you started talking a little bit about your educational journey up to the point where you came here to the US. Can you tell us a little bit more of what happened once you got here and what your educational journey looked like afterwards?
Yeah, it's an interesting story. Sometimes I tell the stories to the residents because I think they have to understand what we go through to come here and how we got where we are. So when I took my exams, I failed the English test. My English was not that great. I had a good grammar. I could read, but I couldn't speak very well. So I took the exam. I passed my first 2 parts, and I said I have to go to Miami to take my English test. So I flew to Miami, and I remember that I didn't have a lot of money. I didn't want to ask my father for more money. So I remember my uncle gave me $200 in Miami. He said, look, $200, why don't you try to go to another place to see if you can connect with other people? So at that time, when I went to Miami, I spoke with the daughter of the dean of the Harvard Medical School. The dean of the Harvard Medical School was Dr. Tosteson at that time in the 90s. And his daughter was married to the uncle of my ex-wife, my first wife. So I spoke with her. I said, look, I want to go to the United States. I want to come here to the United States to do my surgery training. Can you speak with your dad to see if he can help me? So the daughter of the dean called her father. And the dean said, yeah, I'll be happy to help him. So I think I was crazy. And I said, I have to go to Boston. So I flew to Boston. I didn't have any idea how difficult it was to get an appointment with the dean of the Harvard Medical School. So I showed up at the building behind the Brigham. And I remembered I talked to the doorman, and the doorman said, "Who are you?" I said, "I'm Dr. Picon. I'm a physician from Venezuela. I want to speak with the dean." So the doorman looked at me and I said, "Okay, let me go into the building, wait outside." It was a freezing day in January in Boston. I was freezing. I didn't have a jacket. So he left me outside for 10 minutes, frozen. And after 10 minutes, he came back and said, "Okay, go inside the building and talk to the secretary." And I remember in the 90s, we didn't have internet, we didn't have computers. So I asked the secretary, "Can I speak with the dean?" And she almost laughed at me and said, "Look, let me see when you can see." So I started looking at the calendar and said, "Maybe in 3 or 4 weeks, you can see him." He said, "No, but I'm from Venezuela. I want to see him tomorrow or in 2 days. I'm going back to Venezuela in 3 days." So the secretary said, "Let me talk to him, see what he says, and I'll let you know. I'll call you." So I went to the hotel, and when I went back to the hotel, I got a message saying the dean of the medical school, Dr. Tosterson, wants to see you tomorrow at 9 o'clock in the morning. So that was the way I got into the dean. So I said, maybe the dean is going to talk to me for 5 minutes, say hello, and then send me to somebody else. So I went to the dean office, and he sat with me for an hour, talked to me at what I wanted to do, why I wanted to be a surgeon. He really put me in touch with the I think it was the director of clinical affairs for the Harvard Medical School. And that person in 1 hour found 5 interviews with me, with the chairman of surgery at the Deaconess, Dr. Steele at the time, with the Dr. Castañeda, who was the chief of pediatric surgery at the Children's Hospital, and some clerkship directors. So I started my rotations 6 months after that at the Brigham doing internal medicine. I went to the Deaconess, where you are, for 6 months doing cardiac surgery rotations because I wanted to be a cardiac surgeon. And I did some rotation with Dr. Lojerfo at the vascular service during rotating through the vascular service at the Deaconess for approximately 3 or 4 months. And that's the way I came to the United States. Of course, I applied, I didn't match. Finally, using my letters of recommendation from Harvard, I got a preliminary position at Mount Sinai in New York City, and that's when I started my residency.
Wow, that was that's such an incredible story. And I think that, that takeaway message of like how important it is, one opportunity, one conversation can open so many doors.
Mm-hmm.
And then, later that's what helped you end up getting this, preliminary position and then a categorical position. Mm-hmm. Who else, or who would you say were your most important mentors or sponsors throughout your training?
That's a good question. I think it'll be complicated to answer because I had so many people that really helped me during my career, my training, people that were really important for me. And starting with Dr. Tosterson in Boston, he was a person that opened the door for me. When I was in residency, not many people in residency at the beginning of my residency, because as you can understand, Mount Sinai had like a 37 interns. So I was one of 37 interns rotating through 3 or 4 hospitals, huge program. So I didn't have like a person that really or a mentor, because at the time we didn't have mentors. But later on, when I went back to Venezuela and came back, because after my first 3 years of training at Mount Sinai, I couldn't match in a categorical position. So I did 3 years of research at Memorial. When I was at Memorial, and that was another story, when I applied for my research fellowship, I sent letters to Memorial because I wanted to go to Memorial. They ignored my letters. One day I showed up at Memorial. I said, I have to go. I went there. I said, look, I want to do a research fellowship. And they told me, no, we don't have a position here. And I kept insisting, sending letters. Finally, I got a research position. And in that research fellowship, the person who was in charge of the lab, Dr. Patey at Memorial, he was a very good mentor. He really helped me. I didn't know anything about bench work. He took me through the bench work. I learned how to do PCRs and basic science research. It was an amazing experience for me. Memorial. When I was at Memorial, I matched as a PGY4, not match, but I got a position, a PGY4 position at University of Massachusetts. And I remember that I signed the contract, was ready to go to Worcester, Massachusetts. And a week before I moved to Worcester, they called me and said, no, you cannot go. You cannot go because you have a J1 visa. You have to go back to your country. Couldn't get another visa. You have to go back after 3 years of training, 3 years of research. So I went back to Venezuela with my 2 kids, the twins. I'm not sure if my son is on the call, but we went back when they were 2-month old. So I have to apply to do residency in Venezuela. So I trained in Venezuela for 3 years, worked there for 3 years in a private public place. And I insisted to come here. So I applied and I came to Memorial to do the international fellowship. And when I was doing the international fellowship, I met a lot of people, including Dr. Patey, other people that really, really helped my career. And they helped me to get a PGY 4 and 5 position so I could finish my training in the United States and sit for the boards. And that's when I went to Mount Sinai, Beth, Israel, in the city. And Dr. Enker, who was my mentor, was a really amazing person, amazing surgeon. And he was really the person that really guided me and told me what to do, what not to do, how to be a good surgeon. And he was a very, very good mentor. And somebody told me a couple of weeks ago, or I heard that from in a conference, saying that a mentor is like a tattoo. Is a person that you have with you for the rest of your life. And actually, I have in my office his picture, and I see his pictures every day. And I always say how he would handle this situation, how he would treat this patient. And he's a person that really, really helped my career. He sent me to Japan for 3 months as a traveler, a traveling fellowship experience. And that was an amazing experience for me. But Dr. Enker was an amazing individual. And when I went to Staten Island, I met another surgeon that he might be on the call, is Dr. Pahuja. He's a surgeon from Pakistan. Amazing surgeon. He helped me in very difficult surgeries. He really helped me to grow. When I had a problem, I used to ask him, what do you think I should do? And he's a fantastic person. So he might be on the call today. And thank you, Dr. Pahuja, for everything that you've done for me. So those are the 2 people that I would say, or 3 people that were really good mentors to me.
Wow, I have to admit that after hearing your whole journey, I think that, the perseverance and the way you manage all the obstacles that you face throughout your career, it's impressive, really. And seeing you now have this leadership position after everything, I think that it's a great message to send to the younger generations and to all other IMGs that are currently going through that process. If you had to choose the greatest obstacle in your career or in your career advancement, what would you say was the greatest obstacle that you faced?
I mean, one was to go back to Venezuela. I think was a major obstacle. Yeah. Can you hear me?
Yes.
Yeah. So we're back. So going back to Venezuela was a major obstacle because I thought I'm not going to go back to the United States. I cry. I think this is the end of my career. I might not become a surgeon. Actually, at some point, I thought I was going to become a pathologist or something else. And I said, I'm not going to finish my training, but I persisted until I came back. And the other obstacle in my career was, I think, as a foreigner, as an international resident, was the language. For me, it was a very difficult thing to overcome. It's not like I had a bad English, but for me to come to, let's say, Mount Sinai, where everybody spoke English, everybody was American, for me was difficult. So I always try to speak better English every day. I said I have to understand everything. So I used to put a radio in the shower to listen to English. I never watched a channel in Spanish. Said I have to read, I have to learn, I have to improve my English. I remember during residency, for me, it was difficult to present cases in public. And I remember that I used to practice the night before every night how to present cases on rounds. So when I got to rounds the next day, my English was flawless, with no problem. So for me, it was like a lot of stress. I think it was a very difficult time for me in my residency because, we don't go to medical school in English. We go to medical school in Spanish. And for me, it was a very difficult thing to do. And I remember that during my vascular rotation, during my first year of internship, was so difficult that one day I was walking upstairs to see a post-op patient, and it was like at 2 or 3 o'clock in the morning. And I remember that I sat down in the stairway and I started crying. And I said, I'm going to go back to Venezuela tomorrow. I cannot take this anymore. I think it's too difficult for me to do surgery here in the United States. I cried for 5 minutes, and I still think I want to cry when I remember that moment, because for me it was a point that I almost made the decision to go back. And I said, no, I want to keep going. I want to overcome this problem. And I kept going, and I finished my training. And looking back, sometimes I think, oh my God, I almost quit. But I always tell the residents, I said, look, don't quit. Sometimes we go through residency and we have obstacles, we have problems, we have issues, we become depressed, we're sad. We think that we're going to finish. We think that we're not going to be a good surgeon, and we want to quit. And said, don't quit. And I'm a mentor of many residents, and I had many residents that came to my office saying, I don't want to continue doing surgeries, too much for me. And I said, don't. And I tell the story about me almost quitting one day because it was difficult to overcome, everything. And I said, I didn't quit. And I'm a surgeon today. I'm a successful surgeon. So keep going. And many of these residents never quit. And they are surgeons, and they're happy, and they're doing what they love to do.
Wow. And I think what you said, it's so important to normalize these conversations. And, when I imagine that when the residents hear this from you and they see you, a full surgeon with fellowship at a leadership position, they're like, if somebody that has achieved all this had those thoughts, it's okay for me to have those moments of weakness where you can also think or have those negative thoughts. Can I ask, what were some of the tools or some of the things that you thought were important to help you overcome those obstacles? Any specific support system, any tips for wellness that you used during that time that helped?
That's a great question. And the reason it's a great question is because now in 2022, the residents have many tools. They can go to a psychiatrist, they can go to a psychologist, they have wellness programs, as you know, something that we didn't have when we were residents. We used to work more than 100 hours a week. We didn't see our families. Sometimes I stayed in the hospital for 3 or 4 days because it was easier to be in the hospital. But I think it was the support of the family. My first wife, Mariela, who was with me, she was a huge support for me. She was there for me. She understood what I was going through. She gave me the support. She used to cook for me. She used to take meals for me to the hospital. To the point, I remember just now that my first day on call, she came to the hospital with a meal around 7:30. And I said, okay, let's sit down in the cafeteria to eat dinner. And I remember that every time I sat down, they paged me. So I answered. Came back, they paged me. I answered. They paged me 20 times in a period of 10, 15 minutes that I couldn't eat. I couldn't eat anything. I said, I'm going to put this in the fridge. You have to go home because it's late. I'll eat it later because I have too much work. And I never ate that dinner because I was so busy. But I think my wife at that point, Mariela, was, I think, a big support for me. And I cannot thank her enough, because I went through, we went through a lot, not only the training, but the stress of being here with a J1 visa, thinking that maybe the next year we had to go back, was the daily stress, to be in that environment and to survive residency, to survive the fact that we didn't have enough money, to survive the fact that we had a J1 visa and she had J2 visa, she couldn't get a job. But we went to, so let's take it day by day. And I think that was a big support for me.
Thank you for sharing that. And I agree. I think that uncertainty of not knowing what's going to happen, it definitely doesn't play in your favor when you're having those negative thoughts. So I completely agree. If you could give your younger self some advice, do you have any specific advice that you would give yourself?
So many things, I cannot think of a particular thing. The only advice is to plan things ahead, to have some strategy in whatever you want to do in life. It's like before I came to the United States, I started how to take my exams, when to take the exams, when to come to the United States, how to get positions, how to do clerkships here to get letters of recommendation. Because we come from outside and our letters of recommendations are in Spanish and nobody can understand anything. And they are very short letters compared to the very long letters that we have here in the United States. So I try to be ahead of the game, think about 1 year ahead of me. Everything was a strategy when I was going to take the exam, when I want to come to the United States. So if you plan your application process, I think is the best way to be successful. Now, I think you have to do more research. Maybe I could have done a little bit more research before I started my residency. But at that time when I started, I remember that I was really desperate to get my position in a residency program and get it done. I didn't want to spend 1 or 2 or 3 more years doing research and trying to reapply. And I think maybe if I had to do everything again, I would have done maybe a little more research before my residency and tried to get a H1 visa instead of J1 visa, because J1 visa has a lot of problems, the waiver, etc. In terms of residency, I think I did the right thing. In residency, I used to see what rotations the categorical residents were doing during the 2nd and 3rd years. And I requested the program director to give me those rotations so I could rotate through those services in case they had an opening in the categorical position. And I already had my rotations. So I was always thinking what to do, how to fill the rotation, how to complete whatever I had to do to get a categorical position. But I think it's about planning. And the other thing was, I never believed in anybody. What I'm trying to say is that when we come from another country and we come to the United States, always you're going to find people that will say, Antonio, we'll help you. We're going to get you a categorical position. When I was in Venezuela, many surgeons told me, if you pass the boards, I'll get you a position at NGH because I know the chairman. And I said, okay, great. You're going to get me a position at Harvard. That was amazing. But when I came here, I started applying. I realized that was not true. Nobody helped me. Nobody wanted to help me. And I said, it's me. If I don't work hard, if I don't do my things myself, nobody's going to help me. And that's the way I thought. He said, I don't want anybody to help me. I want to work so hard. So that's going to be me. If they're going to see somebody, it's going to be my CV, my work, my honesty. And that's what, and that's why I worked so hard at the beginning to be successful at that time. But it's difficult. I think it's difficult to know what you should have done differently. And I don't know. I don't regret a second about what I do now. I love surgery. I think it was the right decision. But having J1 visa was a bad thing for me because I had to go back to Venezuela at that time. And for me, it was the worst nightmare in my life. Going back to Venezuela and do residency there was very, very difficult for me.
I can only imagine how difficult that was, Dr. Picon. And I think that, you've shared so many pearls of wisdom that I think, and I see in the participant list that there's a lot of IMGs that are actually applying to surgery currently. So I think that a lot of the things you've shared are going to be very useful for these future applicants that are starting their journey in surgery. And for my next question, we talked a little about having a support system and a little bit about the wellness tools. Can you tell me a little bit about your life outside the operating room now currently? How have you achieved work-life integration?
Yeah, who told you that I had a life outside? No, that's a very good question because I think now I think I have a life compared to when I was in residence. I don't think I had a life. I was working to the point, as I said before, sometimes I made decisions being in the hospital as a resident to stay in the hospital so I could sleep one more hour when I was on call, because we never went home the next day after surgery. So when we were in the hospital for 40 hours in a row, sometimes going home for an hour, that was 1 hour less of sleeping that I had that night. And sometimes I say, look, it's 9 p.m. If I go home, it's going to be 10 p.m. by the time I go home. And if I wake up in the morning, take a shower and come back, it's going to be another hour, half an hour that I want to waste. Sometimes it was better for me to stay in the hospital that night and sleep one more hour. So the wellness at that time didn't exist because we didn't have wellness at that time. But now over the years, I always tell the residents, go home when you can. I tell the chief residents, round early so the residents can go home. If I see a resident that is very tired, go home and rest. I do a lot of things outside the hospital. So usually at 5 p.m., I go home, I work out, and as you know from my CV, I do triathlons. So I train maybe 10, 12 hours a week and do long distance triathlons. I completed approximately 6 Ironman long distance triathlons in my life. And actually I'm gonna finish an Ironman in Australia in 3 weeks from now, because I said a few years ago that I wanted to finish one long distance Ironman in every continent of the world. So I did New York, Japan, Austria. In April, I did South Africa. And in December, I'm going to do Australia. So I do a lot of things outside. And I think that helps me a lot to manage my stress. Sometimes I have very stressful weeks with a patient that had a complication, very stressful week of work, very busy, but going to the gym, running an hour, swimming, biking, that gets rid of my stress. And that helps me a lot. And the other thing is that helps me to plan my life in a way that I can travel. I can plan the life with my wife. Let's travel, let's do triathlons. And that keeps me busy. And I think everybody should think that way. I mean, should have something outside medicine that you do outside the hospital, and you put your mind, your brain, your time doing something completely different. Otherwise, it becomes very, very difficult to deal with the stress that we had every day in the operating room.
Yes, no, 100% agree. And I think that is a great description of work-life integration, of integrating your wellness and fitness journey with traveling and having your family be involved in those trips. I think that's a great advice of how to integrate everything and make the best out of the time you have outside the operating room. Dr. Picon, let me ask you, do you have any hopes or any specific advice for rising Latinx Hispanic students that are aspiring to become surgeons?
I think the same thing that I said before in terms of having a strategy. When you are a medical student, sometimes you don't know what you want to be, especially in the United States, that you jump from medical school to residency. And some students, they think they like surgery, but when they start surgery, they think it's too much. And some people go into medicine, go into psychiatry, pathology, and they say, this is not for me. Unfortunately, we don't have that transition a year or 2 years of internship that we have in many countries in South America that make you a little bit more mature and you can understand what exactly you want. We don't have that here. So I would recommend the students, especially in the United States, is to rotate through surgery, not only as a third year as your core for your core courses, clerkships, but as the fourth year to start rotating at the beginning of the year, at least for 2 or 3 months, so you can get letters of recommendation and apply. And at the same time, to see if you really, really like surgery. And trying to publish, trying to do some research, try to build up your CV, especially if you come from outside the country. When I came to United States, I said, I'm top of my class, or one of the top of my class in Venezuela. I got great scores in my exams. I said, I'm gonna go to Harvard. This is what this thinking I had, and I didn't have any idea how difficult was going to be to apply to surgery in the United States. And if you see the applicants now, applicants that they apply for surgery, they have NPH, they have PhDs, they have MBAs, we have amazing applicants. And to compete with those applicants coming from other countries, especially from South America, is very difficult. So if you want to come here and you want to be competitive, try to publish, try to do something different, be involved in leadership positions, because we look at that. Now that we don't want to pay too much attention to the scores because it's going to be passed or failed. So I think it's going to be more important to have a better application to apply for a residency program. And I always recommend people coming from outside the country to ask somebody to go over the CV. We as Hispanics and Latinos, we tend to put too many names starting from the name. So I say some people put like 10 names or 3 last names, and nothing bad about that because we're proud of our last names. But I've heard program directors saying this applicant, the last name is too long that I cannot pronounce that last name for 5 years. I heard program directors saying that, which is the wrong thing. But that's the way sometimes some programs directors see it. So I always tell the Latino applicants, so why don't you put your first name, maybe your second name, and then your last name to avoid that type of problems. And I usually review a lot of CVs of people from my country that they send me the CV. I correct them, try to make them more organized, because when you apply and you start putting a lot of names of hospitals in South America, rotations that nobody understands, people won't understand your application and they will discard your application before they interview you. So I think it's very important to work on that when you interview, and to try to do many things to build out your CV. So when you interview, you are there. I always recommend to practice your interviews with other people. So can you interview me? So you practice your interviews, because sometimes that impression that you give their interview is so important now, especially now that we're not going to we don't want to pay attention to the scores, because if you don't interview very well, that program might not consider you to rank you for that particular surgery program. So I think it's more about building the CV, have a good mentor, practice for the interviews, and try to get ready for the match.
Thank you, especially now that it's interview season for the MS4s and for the IMGs applying. I think that those are all excellent advice, and I'm sure everybody in this webinar appreciates it. Well, I think that now it's time to see if there are any questions from the audience. And I actually already have one that came very early on from the audience. And so it says, thank you for sharing such an impactful story. Have you noticed any changes over the years regarding the receptiveness or support of IMGs by residency programs?
Yeah, and I lost have you noticed any changes? I lost the signal.
Yeah, no, I can of course repeat the question. It says, thank you for sharing such an impactful story. Have you noticed any changes over the years regarding the receptiveness and support for IMGs by residency programs?
I don't think it has changed a lot. Actually, recently, I noticed that maybe it's less. because we have more American medical schools that opened in the last few years. We have more Americans going to Caribbean medical schools, so that's another layer of applications. So that's international medical students. But I think it's about the same, and all depends what programs you apply. Sometimes some programs, they don't take anybody from outside. They don't take people with visas, J1 or H1 visas. They don't take Latinos. They don't take Black people. They don't take any minorities. So, which is a problem. So some programs are more open to that. And I think when you apply to a program, try to pay attention who is a resident in that program. Sometimes me as associate program director, sometimes I open a website of a program and I say, let me see the residents. And you see that all the residents are white and not a single Latino, not a single Black person. And they don't have any underrepresented minorities in that group of residents. So if you apply to that program, most likely you're not going to get an interview, or if you get an interview, you're not going to match in that program. But if you look at other programs, even larger programs like a Mayo Clinic, even Harvard programs, they might give you an interview. They're more open for diversity, and I think now that we're talking more about DEI diversity. I think many programs are trying to incorporate international medical students for the application process. But I think you have to look into what programs are taking international medical students and what programs are not, so you don't waste your time, and see what programs you have more of a chance to get an interview or getting matched in that program. But it's not easy, and I think we don't have a good representation in many programs. And I think one of the things that the society can do is not only what we're doing now today, but it's to try to create that pipeline from medical students to residency, trying to create more rotation, more opportunities for the Latino or international students to be more visible, so they can match and be interviewable, get an interview in a good program.
Perfect, thank you. I think that was a great answer for that question. And I agree. I think it's not only for the IMGs to not waste their time, but also the money, because I think, applications can end up being very expensive. And if you're using a lot of money into programs, like you said, that they're never going to interview you, I think that it's a very good advice. And I think we haven't talked a lot about the surgical oncology part of your career. And so there's actually a question about that. And do you have any specific advice for residents deciding to pursue a career in surgical oncology? Are there any specific factors that drove you to decide a career in surgical oncology? Diversity of procedures, pathologies, or research?
Yeah, I get that question a lot from many of the medical students applying to residency. And if I go back a little bit, how I chose surgical oncology, as I said at the beginning of the program, I wanted to be a pediatric cardiac surgeon. And when I started doing rotations as a surgical resident in cardiac surgery, I thought cardiac surgery was a beautiful surgery, very technical, excellent technique, but it was the same all the time. It was like a valve, open the chest, off pump. And I thought that was always the same thing. And I thought, well, this is boring for me. I didn't like it. So that's why at some point during my PGY2 year, I said, I'm not going to be a cardiac surgeon. I started going to tumor boards. And when one day I went to a tumor board and started presenting melanoma, sarcomas, colon cancer, I said, oh my God, this is amazing. This is a different tumors, different location, different biology, different staging, different options. And it's so much that we don't know about cancer that is so open for research opportunities that I started reading a little bit more about oncology and surgical oncology. And one day I said, I love this. I want to be a surgical oncologist. So I applied to do research. So one of the things, if you want to go into a good program in surgical oncology, you have to do at least 1 or 2 years of research in cancer somewhere in the country if you want to have a chance to match in a good program. Or if you don't have that opportunity, try to see if you can do some research. We publish 2 or 3 or 4 papers during 5 years, so you can put that in your application and trying to see if you can get a surgical oncology position. But surgical oncology has changed a little bit. And surgical oncology 40 years ago was a lot of head and neck, and it has evolved more into HPV, foregut surgery, more than melanoma or sarcoma or breast. Now we have breast surgeons, we have thoracic surgeons, we have colorectal surgeons. So it became very diluted, and it's more about HPV. And even some surgical oncologists are doing a transplant surgery fellowship, because the transplant surgery fellowship will give them the skills to do major and complex HPV surgery that maybe a surgical oncologist cannot do. Let's say resect the cava or reconstruct the portal vein in complex cases. So it might be difficult for a surgical oncologist to do that. So I think if you want to do surgical oncology, try to start thinking about research and strategize your rotations so you can do more surgical oncology rotations in your residency, and try to see if you can get an elective rotation in a major center like Memorial or MD Anderson, so you can have your letters of recommendation and see if you can match in those programs.
That is wonderful advice. Thank you, Dr. Picon. And for this last part of the webinar, it's time for our rapid fire questions. And so I'm going to ask you some questions, and we want you to answer the first thing that pops up in your head. Are you ready?
Yeah.
What is your favorite city?
Rome.
What is one of your distinctive operating room preferences?
Tonsil clamp.
It's a good one. What is your favorite food?
What? Repeat that.
Favorite food?
Lasagna.
What is your favorite thing about the operating room?
That you feel isolated, and I think you feel like you are in one position, in one place, that you can enjoy your time doing what you love to do.
What is your least favorite thing about the operating room?
When the nurses don't have the instruments that I like.
Is there one thing you do every day? And if so, what is it?
What you repeat that question again?
Is there one thing you do every day? And if so, what is that thing that you do every day?
I do training. I do a lot of training, biking or running or swimming.
If you couldn't be a surgeon, what other profession would you like to attempt?
Maybe an astronaut.
That's a really good one.
Yeah.
And then final question. What is the best gift you have ever received?
The best gift, believe it or not, when I got married, somebody gave me a $10 bill. And I don't remember that it was the best gift because that person didn't have any money. And that person somehow came up with $10. And they said, look, I don't have a lot of money, but I'm going to make the effort to give you $10. And that for me, that was almost in dollars was nothing, but for me was the best gift I ever got in my life.
That's a really nice gift. And this is a first for our Inside the Operating Room webinar. We have a suggestion for a rapid fire question from our audience. And so they want to know, what was your favorite school subject?
A school subject? I think it was the geography, then my country's geography. I think I enjoyed that very much.
That's awesome. Well, I think those are all our rapid fire questions. But once again, Dr. Picon, I really want to thank you for joining us today. I think that you've shared your whole life experience, and I have to be honest, like I identified with a lot of what you said, and I think that you are the perfect role model for any IMGs that are currently pursuing a career in surgery or want to pursue a career in surgery. And I think that, like you said, normalizing those thoughts, seeing all the struggles and just facing the difficulties and moving forward are things that I was able to understand a little bit better after having this conversation with you. So thank you so much. I am sure that our whole audience will really appreciate it.
Yeah, no, thank you for the invitation. And if anybody in the audience or anybody in the society, they want me to, talk to them, advise them, be a mentor, I'll be happy to help them, because when I came here, nobody helped me. Nobody was there to be a mentor here when I came. So I'm open to help people and guide them and help them review the CV, review the application, talk to them. So I'll be happy to play that role.
Thank you. We'll make sure to let the audience know, and then we can definitely connect you with them. And then we have a final message from the audience that says, thank you for your resiliency and the motivation provided to push through. And so, like I said, I think you've been a wonderful inspiration to a lot of people that logged into our webinar today.
Well, thank you so much again. Okay.
Thank you to all our participants also who tuned in this evening. If you're interested in learning more about our organization or becoming a member, you can find us at latinosurgicalsociety.org or on our various social media channels at Latino Surgery. And the recording for this event will be on our YouTube channel shortly. Buenas noches a todos, and thank you for joining.
Thank you. Take care. Bye-bye.